Hello and welcome. My name is Daisy Malinga. Welcome to another episode where we discuss aspects of mental health and mental illness, and we just break it down in an African setting and what we really understand. Today, I want to talk about the various healthcare providers that work in the mental health department. I will start off with a psychiatrist. A psychiatrist is somebody who is a doctor who works in the mental health department. Most times when we find the diagnosis of mental illness, or when we have a suspicion for a mental illness, we have to rule out a physical cause, because there is a relationship between something physical and something mental per se. So we need to have a doctor. So this doctor usually sends patients for examinations. So we'll do a lot of scans. We'll do a lot of brain scans. We might send somebody for an MRI, for a CT scan, just to rule out that there is no organic cause. By organic, I mean there is no physical cause for this mental illness. If there is a physical cause, we prioritize to treat the physical cause before we can actually conclude that it's a mental illness. So this psychiatrist usually sends people for this scanning and imaging tests. They send people for blood tests and lab tests just to rule out whether there is a substance use disorder, or to support the diagnosis of there is a substance use disorder. So that's the first person, psychiatrist. And they are the ones who also prescribe medication, which you call psychotropic medication. These antidepressants, these sedatives, these antipsychotics, it just brings you back to the awareness of what is happening in the physical context. So that's the work of a psychiatrist. So the psychiatrist will start you off on medication, and they're the ones to give authority whether the medication should be stopped. Okay, so the second group of people I'm going to talk about is the clinical psychologist, which is what I do. So the clinical psychologist usually treats using a method called psychotherapy, counseling, but in the medical context. So what I basically do in the first session, I do something called assessment. So whenever somebody has mental illness, we can't open up your brain to find out what is going on in your brain. So what we basically do is we ask you questions. And these questions start off from biodata, from what has brought you to a therapy session today. And for you to just tell us, where did this problem start from? Have you tried any other solutions? We do a lot of assessment in terms of what is your social background, what is your educational background. It's just all these things. Have you used a drug before? Have you worked before? Has it affected various aspects of your life? So that is basically what we do in terms of assessment. So Assessment is broken down in three parts. So we do the face-to-face interview where we ask questions. And then the second part in assessment is that we administer tools. As I said, we can't open up your brain. So we administer tools, and these tools are just a set of questions that are aligned to a particular diagnosis. I'll give an example of something called Beck's Depression Inventory. That is a screening tool that is meant to assess whether you have depression or not. So it has questions in line with depression and whether this person has depression or not. So that is the second part, is we administer psychometric tools. Although there is experts who are called psychometricians who specifically administer these psychometric tools, but we're also skilled and learned in how to do it. The first thing is the questions, the second thing is the psychometric tools, and then the third thing is what now the psychiatrist does, sends for physical examinations, just whether there is an underlying biological disorder. Let me explain why we need to find out whether there's an underlying biological disorder. Something like HIV can present like a mental illness, but it's not really HIV. If you've heard of an illness called meningitis presents with some kind of confusion where somebody does not really understand where they are. So in that case, we will deal with getting the person back on medication so that we treat the underlying condition, which is HIV, as opposed to giving antipsychotic medication, because HIV can present with some kind of psychosis. The same thing happens with diabetes. Most patients, when they're having their diabetic episode, they start to experience some kind of delirium or some kind of confusion. So we need to do tests to just find out whether this person has an organic disorder, so we can treat the organic disorder. So a clinical psychologist or a therapist, per se, you'll see us using those two terms interchangeably. We usually do therapy sessions in various parts. So after we've done the assessment, we usually move to the part where we now have a diagnosis. So we sit down together with the psychiatrist and say, hey, I think in relation to what we have picked up, this is the diagnosis that we are coming up with. So once we have a diagnosis, then we find out whether should we give medication or should we use psychotherapy interventions. There are some things that we will need medication together with psychotherapy. There are things that we need psychotherapy and not medication. Okay? In the part where we now decide to have therapy sessions, we've already done the assessment, we've already done the diagnosis, and now we're at the point of treatment. So treatment takes place in various forms. So it can be one-on-one counseling, that is, I do a session with that individual, which we call individual counseling. It can be couples counseling, where we do it between a spouse and another spouse, like a husband and a wife, a boyfriend and a girlfriend, or whichever form that is going to take. Or sometimes we do family therapy in the point where it's like it's a dysfunctional family. It's like the whole family has a problem and we just need to deal with the whole family because of roles are being confused. Nobody knows what is supposed to happen, So that at that point we do family therapy. And sometimes we even do group therapy. For in group therapy, we bring together people who are experiencing something similar. Say, for example, if you persons that are living with bipolar, I know there's a lot of groups that do that. So if you're somebody who's living with bipolar, you can be together with other people who are living with bipolar. If you're a caregiver supporting somebody living with bipolar, you also meet in groups. If you're parents and you're having children who are having behavioral issues, we can get you together in a group. If you've even heard about Alcoholics Anonymous, Narcotics Anonymous, so they sit together in a group and then they share support stories. So that's the different forms that counseling takes place. Feel free to drop a question or a comment in the comments below here, just to tell me if what you really need to know about all this. I have so much information and I'm just trying to decipher what is really useful or what you really want. The next cadre, we've talked about psychiatrists, we've talked about clinical psychologists, and now we'll also talk about occupational therapists. So occupational therapists, basically what they do is they help child, especially they help you rehabilitate you back to your function. So say, for example, if a child has delayed milestones, so they're not able to walk, they go to an occupational therapist. If a child has issues with something called hyperactivity in attention deficit hyperactive disorder, then they go to an occupational therapist who just helps them calm down. Okay? If a child is delaying in terms of activities of daily living, and not only child, because this is more of neurodevelopmental, if even an adult is delaying, if somebody is at the age of 5 and they're not toilet trained or they're not potty trained, then you'll need to go to an occupational therapist. The next person that we're going to talk about is the medical social worker. So the medical social worker helps these patients with social issues. So, and at this point for medical social worker, allow me to use this example. In our practice, we came across a mother who had 2 children. So the mother comes in for a session. They come into the hospital for mental health care. So this mother is diagnosed with schizophrenia. And because she's diagnosed with schizophrenia, she comes, the psychiatrist gives the diagnosis and then dispenses the medication, that is the antipsychotic, to help with the psychotic features in schizophrenia. So this mother has come accompanied with her 2 children. For us, we do the counseling, we do the psychoeducation, we tell her about how to take the medication, but she goes home with her children, and the children don't have a problem. It's the mother who's diagnosed with schizophrenia. They go home with the children, and as she goes home with the children, she decides to give the medication to her children. So this is where a social worker comes in. The social worker comes in to help to check the social setting, to just get these children. Can we have a trusted caregiver who can take them in as mommy tries to get better, understands her diagnosis. Once mommy is not posing a risk to the children, then we can return the children back to them. Social workers are also very important to just help us trace our patients. Most of our patients have poor adherence, that they are not able to take their medication in time and they're not able to come back for their follow-up visits. So they help us do a lot of follow-up, a lot of repatriation. Repatriation is just basically returning this person back to their home. And we work closely with other healthcare providers, like pharmacists. We need somebody to dispense this medication, like nutritionists. These very important nutritional benefits that are there, especially for these children. I'll give an example for autism and ADHD, that is for hyperactivity. We usually advise the mothers to have a low wheat diet or to have low sugary diet. And maybe a parent will come and ask, so you've taken away the wheat, what else do you want us to take? My child doesn't like nduma and ngwashe, that is arrowroots and sweet potatoes. What else can I really give? So the nutritionist usually provides the nutritionals. I think those are the major. Oh, and we also have the mental health nurses. So the mental health nurses, they administer medication to these patients. They also do psychoeducation. They try and tell the patients what they're supposed to do. They care for the patients, especially if they have been admitted in the wards. They're the ones who basically care for these patients as we rehabilitate them back to their normal functioning. Thank you very much. Let me know down here below on other topics that you'd want me to talk about. But thank you so much for your attention and have a good day.